Hello, everyone. Welcome to the Glow Podcast. Today, I have a very exciting guest here with me today, Dr. Ezra. If it's your first time here, we are Tailored Marketing and we help dermatologists, skincare clinics, and aesthetic clinics grow their practices. So if you're interested or want more information, drop a comment below. Can you Dr. Ezra, just go ahead and give us a little bit of an introduction to who you are? I'm super excited to have you here today.
Hi, Taylor. Thanks for having me. My name is Navid Ezra. I'm a board-certified dermatologist. I am the founder and the CEO of California Dermatology Institute, and we have over 20 office locations in Southern California, and we're expanding into other states as well, doing medical and surgical dermatology. We see all patients with any insurance, even patients who don't have insurance. We have reduced rates. And our mission is really to improve the access to medical dermatology care. And we're really excited to be on the show and talk about that.
Yeah, no, that's awesome. Yeah, I feel like looking at y'all's mission and everything online, it was definitely very inspiring to see the focus that you have on your patients and really just their, like you said, kind of medical care being at the forefront of what you all do. So can you tell us a little bit about kind of what inspired your journey into dermatology and obviously eventually with that California Dermatology Institute as well?
Sure. I think it really goes back to the training that I had. I went to UCLA for undergraduate and for medical school. And when I was in medical school, I was considering different specialties to go into. I rotated through county hospital, and at county hospital, I saw a patient with skin cancer undergoing Mohs surgery. And Mohs surgery is a specific type of skin cancer surgery that's performed where the skin cancer is removed and there's reconstruction done. And I saw what an art form it was. I saw the care that was provided to the patient, and I was really interested in going into dermatology and becoming a skin cancer surgeon. As I continued and pursued dermatology residency, I found that there was a huge shortage of medical and surgical dermatologists really throughout the country, and that a lot of dermatologists, after they finished their training, they would go into cosmetics and aesthetic medicine and do Botox, fillers, lasers. And so there was a huge gap in the care that should have been given to these patients with skin cancer. When I started my own practice in Thousand Oaks, California, after residency, I tried to help that population and later on found other pockets that really needed that help.
Kind of finding that gap, especially with something that is so critical like medical care, for skin cancer and really any other type of medical that you need with dermatology, that's obviously a very, very critical market. So kind of in the early days of starting your clinic, and you talked about obviously you all have grown from one location to now over 20. So how has your role kind of evolved with that growth?
Yeah, that's a great question. Initially I was the only provider in our practice. So it was just me. I was seeing all the patients in our initial office in Thousand Oaks, and I would do everything. In the very beginning, I would even answer the phone and schedule the patient when we didn't have a receptionist. And so my role has really, really changed over the years. As my schedule became full, we brought on another provider. As his schedule became full, we opened up a new location and hired another provider. And so initially we were slow to grow, but once we had a good playbook in terms of how to start new offices, how to bring on providers, it became easier in a sense because we had the right team. And I think the right team is so important, and it's not stressed enough. Really, this company is the result of great team members working together to deliver care. And so everyone is important, from our call center that schedules the appointment to our providers that deliver the care. Now my role is more of growth and identifying strategic areas for us to go into and making sure that we have the right team members to deliver quality care to our constituents.
Yeah, I feel like growing from, like you said, a small practice to a fairly large practice now, that your role does change a lot. So that makes sense. And so you mentioned obviously you all are continuing to grow and finding new locations. How do you kind of look at those locations and see that the need is there for your services?
Initially it was us calling around, seeing where there are long wait times, and sometimes we would find that dermatology offices had 4 to 6 months wait time. And so we'd say, okay, well, that's a good area to go into, and we can really provide a service to the community there. Now that we're more well known and we have these offices in these different geographic areas, we'll have payers coming to us. So these are insurance companies that don't have an in-network dermatologist, or we'll have primary care physicians contacting us and saying, do you mind, is it possible for you to start an office near us? We have so many patients that really need medical dermatology care, and the wait times are so long. So now we're approached by different organizations, primary care physicians, payers, and so we see if the volume justifies us coming to that area and starting a new location there.
And so, one of the core missions of California Dermatology Institute is improving access to care. What was the turning point that kind of made you focus on this?
Yeah, I think it's a matter of looking at patient needs and seeing that their need is not met by what's out there right now. And if
Yeah.
patients have to wait such a long time, their skin cancer continues to grow, it becomes deeper, eventually it can become metastatic and go to other parts of the body. And so rather than just cutting it out, putting in stitches, and the cancer is now treated, if it travels to other parts of the body, now the patient needs to be referred to oncology, undergo chemo. It becomes just such a larger therapeutic delivery system that it's so much better to just take care of the issue when it's small, just like anything else.
Yeah. Yeah, get to it at the root of the problem, kind of, for sure.
Exactly.
And skin cancer, too, is something that obviously, if you do catch it, then as you know, it's not easy, but it can be a lot easier than when it is spreading to other parts of the body. So that's great. And so right now, what's happening kind of in the dermatology market that's making it easier or more challenging for you all as a business, or even for patients? What's making it challenging or easier to kind of operate in this market?
I think what's challenging is a lot of insurances are closing their network. So they don't sign on with other dermatologists. They have certain in-network dermatologists. And even though their wait times may be long, it costs them more if they bring on more dermatologists. So this is an issue that we're facing in some geographic areas. We want to become in-network. We want to deliver care to all the members that are coming to us, but the payers are just not contracting with us. So this is a huge issue. It's actually a very controversial issue in the commercial insurance space right now. I think one of the great things about this day and age is AI, and
Yeah.
artificial intelligence is coming into the practice of medicine and also the management of our medical offices. So in our offices, we're employing AI to help with scheduling patients, keeping track of skin cancers, making sure they're treated effectively so that nothing falls through the cracks, getting prior authorizations for medications and procedures that are needed in our offices. So right now we're doing a deep dive in AI. We're integrating it into our everyday practice. We haven't incorporated AI in the medical practice yet. So in terms of diagnosing things or treating things, we're not there yet. But I think AI in the management of our offices has a huge role, and we're actively doing that.
Yeah, I feel like AI going to be used for so many different things, and right now it's just like learning how to use it so that it can help you kind of with the things at your practice, of course. I guess with what's at kind of the forefront of AI right now, do you see there being expansion for it actually developing into something that could help medically with patients?
I do think so. So there are some rashes that are hard to identify what they are, especially for primary care physicians. Some of these rashes they'll only see once every year, once every few years. And there are instruments now that they're developing that you can take a picture of it and it'll give you at least options and diagnostic tools to help you identify which of the different diagnoses the rash could be. So we call that a differential diagnosis. And it
Mm-hmm.
just puts certain things on the radar for primary care physicians physicians. Again, for a board certified dermatologist, hopefully we don't need to use those tools, but I think from a primary care standpoint, it can give them the tools they need to see, is this something that should be referred to the dermatologist or not? And so those tools eventually, I think, will be part of our practice of medicine.
Yeah, no, that's amazing for sure, especially with identifying those things like you said with a primary care physician, and then it's like, okay, do we need to escalate this issue, or is this not really an issue at all? You can kind of be able to see that with those different technologies. And so in your opinion right now, kind of what does for dermatology in general, especially obviously medical and surgical, what does kind of the market look like in California for that? Obviously, you mentioned that you all are there because there's necessity, but are there other kind of like competitors in the market that you all are looking to, or what does that look like for you?
Yeah, I think there's so much growth potential in California. California is a sunshine state, so
Yeah.
a lot of people are getting sun exposure, they're getting skin cancers, so they do need to have surveillance and therapy for when things come up. Are there competitors? Definitely. I encourage it. I encourage other dermatologists to come to this area. I don't consider it competition. I consider them colleagues. So we
Yeah.
have colleagues throughout the state that do what we do. I think we're very efficient and we take all insurances. A lot of our colleagues, they may only take certain insurances, like they don't take the Medicaid of California, which is called Medi-Cal. We do take that insurance. We try to be in network with every single payer so that everyone can get the care they need. That's the advantage that we have. We also have very short wait times. So usually people can come into our office within the same week, whereas other offices, it may be a month or two before they can get in. So I think those are the huge advantages that our group offers.
And for our audience who might not be familiar, can you kind of walk us through some of the primary conditions that you treat and why early detection is so critical with these things?
Yeah, so I think number one is doing skin checks and identifying abnormal growths. Those abnormal growths can be moles that are abnormal. We call that dysplastic nevi. It could be skin cancers. The most common skin cancer is basal cell carcinoma. The second common is squamous cell carcinoma. And then the most dangerous type of skin cancer is called melanoma. And because melanoma tends to travel to other parts of the body, we oftentimes call it malignant melanoma. So it's very important to identify anything that is new or changing on the skin. We'll do a biopsy, we'll make a diagnosis, and then we'll come up with a treatment plan that helps the patient treat that issue. In addition to suspicious skin lesions, we also treat a number of rashes. Rashes are things that come up on the skin that may be itchy or symptomatic or bleeding. The most common there is eczema. It's also called atopic dermatitis and psoriasis. Atopic dermatitis and psoriasis in the past really didn't have a lot of therapeutic options. We just treat it with steroid creams and steroid pills. Nowadays, we have biologics, which are much better medications and have very few side effects. And every day there's a new therapy coming out for these diseases that is more effective with less side effects. So I'm very optimistic that in the future we'll have even better therapies coming out in the pipeline. But even today, we've come a long way from just 5 years ago, 10 years ago, 15 years ago. There are so many new therapies out there. So those are the most common things we treat, but we also treat everyday things like the common warts on fingers. A lot of kids come in with warts. We freeze them with liquid nitrogen and give them other options as well. Some people come in with fungal infections, whether it be on the toenails or on the feet, but really anything on the skin we treat. Dermatology is a specialty of skin, hair, and nails. So patients with hair loss, whether it's autoimmune types of hair loss or just genetic types of hair loss, nail issues, and run-of-the-mill acne. And with acne, the earlier you get your treatment, the less scarring you end up with.
Yeah, no, that's definitely good. And so for the skin checks, how often should people be doing this? I feel like I've heard like once a year. Do you recommend doing like a personal skin check more often than that, or do you think once a year is good?
Yeah, so personal skin checks should be done at least once a year, and then a physician should be doing a skin check at least once a year as well, and
Mm.
that's based on risk. So if you have light eyes, fair skin, you've had sunburns as a child, you've had previous skin cancers, these are all risk factors. And the more risk factors you have, the more frequently you should be doing your skin check and the more frequently you should be going to your dermatologist. So in our practice, we have patients that come in every 3 months because they have had multiple skin cancers in the past. They have a lot of pre-cancers that need treatment. They have light eyes, fair skin. They've had a lot of sun exposure, and sometimes they've had occupations that were predominantly outdoors. So they worked in construction, or they were in farming or agriculture, or they were school teachers and they worked outside on the field, or soccer instructors. So all of these professions have a very high sun exposure rate, and it really increases the rate of skin cancer.
Yeah, no, that makes sense. So it kind of depends on like a number of factors, but good rule of thumb, at least once a year, unless your
Correct.
dermatologist tells you more.
Right.
And so what happens kind of sometimes, I mean, I know this is different obviously for each different issue, and you want to get to the bottom of things as quickly as you possibly can, but what can happen if things aren't treated in a timely manner, and how does this affect outcomes for your patient?
Yeah, so imagine someone comes or sees a suspicious growth on their arm, right? Initially, it's small, might be less than a centimeter. They call their local dermatologist. Wait time is 6 months. During those 6 months, those abnormal cells are replicating. The tumor is getting larger. It's becoming more invasive. As that tumor grows, it grows superficially, so you see it getting larger, but it also grows under the skin. And so that portion you don't see. And as it grows deeper into the skin, eventually it'll get into the bloodstream and travel to other parts of the body. So if that's melanoma, melanoma loves to go into the lungs. And so over time, patients that don't seek help, they might get a cough with blood coming up. They'll go to the ER, they'll do a CT scan or chest x-ray and identify that they have lung cancer. Where did that lung cancer come from? It came from that initial melanoma that was on their arm that never got treated. So the sooner they're treated, the sooner they're brought in, we can do the biopsy, do the excision, and if they need any other therapy, we can give that to them, called adjuvant therapy, and prevent the metastasis. That's really our ultimate goal, is to limit the skin disease so that it's treatable, and we can do that when it's early stages. Now, let's take rashes, for example. If someone comes in with a mild psoriasis, we can treat that with different topical creams and make that go away. But if it's not treated, it becomes moderate to severe psoriasis. Now they need systemic medications. Systemic medications have a higher risk of side effects. And so with any disease process, the sooner you're able to intervene and help with it, the less side effect potential and less morbidity and possibly mortality the patient develops.
Yeah. No, I mean, that makes sense for sure. Especially like with rashes, like psoriasis too, for the audience, like that would be something that obviously anyone would notice on their body for the most part, correct?
Correct. And some people don't know that it's psoriasis. So they'll
Yeah.
see an itchy rash on their skin. They may think, oh, I have an infection. And they go to their primary care doctor. Maybe their primary care doctor doesn't know what it is, gives them antibiotics. Now they're exposed to antibiotics that they don't need because it's not an infection. It doesn't go away. They get really stressed out. Now they become self-conscious. So they go out with their friends. Their friends are like, hey, what's going on? Why do you have this rash? And so now they don't want to go out anymore into social situations because people look at them funny. So this causes a number of different issues. They sit at home, they become depressed, they actually gain weight, they're not going out. And so this kind of turns into a cycle. And we've seen a lot of studies show that people with psoriasis have a higher risk of depression and are usually obese and have higher rates of obesity. So all of this kind of goes intertwined. But again, the sooner we identify patients have psoriasis, the sooner we can intervene and treat them and prevent this whole cascade from happening.
Yeah, no, that makes sense. And right now, so obviously you all are, this is kind of going a little bit of a different direction from what we were just talking about, but you all are continuing to grow the practice. You have 20 locations, looking to expand, obviously, of course, so that you can go to areas and continue to help people, basically. So what are the goals looking like for the next, year or so with the practice and where you all are looking to go?
So for the next year, we have our locations that we're going to be starting new locations and offices and bringing on providers. In addition to Southern California, which we are right now, we're looking to go into Arizona and Oregon. There are some huge need pockets in those areas. And so we've scattered out potential office locations that we'll be starting within the next year. And we'll continue to grow after that. Really, our mission is to improve access to medical dermatology care. And so there's such a huge need throughout the country. I think just geographically we'll continue to expand locally and into the adjacent states.
Yeah, no, that makes sense. And so what advice kind of would you offer to someone looking to, if they're looking for a dermatologist and they're not able to find dermatological care in their area for medical dermatology?
Yeah, it's really important to find local care because going to a dermatologist is not a one-time event. Really, you want to build a relationship with your dermatologist. You want to be able to go there when you have a growth on your arm. You want to be confident that they're going to diagnose you correctly, be able to manage everything and not have to send you to other providers. That may take a long time. So in our offices, from the time the patient calls us, we get them in quickly. We perform procedures as needed. If they need any surgical intervention, we have providers that do all of that. So they don't need to bounce back and forth between different offices, and everything is kept in-house. So if they're in Southern California or any of our areas where we have offices, they're welcome to call us. We'll get them in and help them. If they're not in our geographic area and there is a huge wait time to see a local dermatologist, they can give our office a call. We track all of that information. And so if there is enough need there, then we go out and we'll start an office in their neighborhood.
Okay, cool. And how can my listeners learn more about California Dermatology Institute or get in touch with you and your team and all of that fun stuff, all the website, social media, phone, all of those fun things? And I'll also put it in the show note as well for easy access for my audience.
Perfect. So the best way is to go to our website. Our website is Cal Derm Institute. So the abbreviation of California is Cal, C-A-L. Abbreviation for dermatology is Derm, D-E-R-M, and institute.com. There you'll see our office telephone number. We just have one telephone number for scheduling appointments at all of our offices. It has information about all of the procedures we perform, all of the diagnoses we treat and manage. You can also get some information about me as medical director and CEO and be able to contact us through email or telephone number. We also have a social media presence, but social media is more of kind of like a fun way to keep in touch with us and kind of track where we're going and what we're doing. I would say probably calling us or going on our website is the best way to get information.
Okay, awesome. That sounds great. Well, thank you so much, Dr. Ezra, and I really appreciate you coming on the podcast. And like I said, I'll put everything in the show notes too so everyone has access to it.
Thank you so much, Taylor. It's been a pleasure.
All right, thank you.
Bye-bye.